Hi, I'm Bob Callis. Joining me today is retired Army Colonel and clinical psychologist Kathy Platoni. Colonel Platoni has been providing for 2 decades mental health services at Guantanamo Bay and in the wartime theaters of Iraq and Afghanistan in operations Desert Storm, Iraqi Freedom, and Enduring Freedom. Colonel Platoni, first of all, thank you so much for your service to our nation.
Thank you very much, Bob. It is truly an honor and a privilege to be here and to have served our nation for 34 years.
Now, you've had quite an extensive career as a clinical psychologist.
Yes, almost 34 years now.
And working with military as well as non-military patients?
That's correct. I've had a private practice since 1993, in between deployments, of course.
I'd like to talk about your area of specialization, post-traumatic stress disorder, or PTSD.
Yes.
Now, you have collaborated in writing and editing 2 seminal reference books on PTSD, War, Trauma, and Its Wake, Expanding the Circle of Healing, and Healing War Trauma, a handbook of creative approaches. It's well known that PTSD can afflict anyone who's been traumatized psychologically,
Yes.
physically, and we also know that combat veterans, many numbers of them, suffer from PTSD.
Absolutely.
Tell us a little bit about how you treat people with PTSD.
One of the most effective forms of treatment that I used both in the combat theater as well as in my private practice is cranial electrotherapy stimulation, or CES. This device has been used very widely throughout the military throughout the last 5 or 6 years, possibly longer. And relief can be obtained from a number of approaches. Cranial electrotherapy stimulation either as a standalone or as an adjunct to traditional psychotherapies. Here's the device itself, the AlphaStim Aid, Anxiety, Insomnia, Depression. And what we do is we attach the padded ear clips to the earlobes, and the therapist will then activate the device, and the patient is then permitted to give feedback about their experience as to whether or not they're having any sensations of euphoria, which is what we are looking to achieve, if they're having any numbness or tingling in their earlobes, and if so, we readjust the setting because it should be subsensational.
Well, as a matter of fact, I've been using the AlphaStim for about 3 years since you introduced it to me, and I generally do a 20 or 40-minute session with my clients. Sometimes 60 minutes seems to be beneficial as well. What about your experience?
Well, very simply, the AlphaStim unit delivers a microcurrent to the brain. Again, it should be subsensational. And this is designed to produce feelings of deep calm, deep relaxation, increased mental alertness, and increased mental focus. This is proven to be effective for the treatment of anxiety, depression, insomnia, as well as some other disorders.
And I believe we have some slides to show
Yes,
that
we do.
demonstrate the results of the research.
Let's take a look at the evidence.
Let's do, absolutely.
Here we can see the results of a study that focused on patients suffering from depression. As you can see, more than 82% of the subjects using the AlphaStim reported at least 50% improvement. Now, moving over to slide number 2, in the study on patients who suffered from anxiety, more than 83% of those subjects reported at least 50% improvement. Now, the third slide is very interesting. Let's take a minute to look at this closely. Both with and without medications, we see improvements for a number of complaints or disorders. Looking at the categories separately, as the percent improvement breaks down, this evidence suggests that for a patient who is using medication for any of these problems, the AlphaStim enhances the positive impact of the medications.
So if I'm hearing this correctly, a patient may be using an antidepressant or an anti-anxiety or a sleep aid medication and use the AlphaStim concurrently, and the use of the AlphaStim will actually strengthen the impact of the medication.
That's absolutely correct.
You know, after I began providing this therapy to my clients, it became evident that clients with anxiety were reporting relief immediately. Now, we know that in America there's an enormous sleep deprivation problem, and it is chronic with soldiers. Tell us a little bit about how you help soldiers who have trouble sleeping.
Certainly. The wonderful thing about this is that it's not sedation. It does not impair the user. And in the combat theater of operations, you cannot have a sleepy soldier because the consequences can be obviously disastrous. This allows sleep to occur naturally for patients, soldiers, Marines, whatever, to be able to get a full night's sleep if at all possible and to be able to function alert, awake, and on target whenever they are on mission.
And not only in the military do we have the sort of imprimatur, the stamp of approval, but we know for decades the FDA has cleared Alpha-Stim in the use of
That's correct.
Anxiety and insomnia, but it's also cleared for the treatment of depression.
Yes.
Would you say a few words about that?
Yes. Now, for people with clinical depression, this usually requires a good 2 to 3 weeks to see the full effect, but you can see a gradual improvement in affect and mood over time. Literally hundreds of my patients have used the Alpha-Stim. Most of them have their own device. Many of them have loaner devices. Many of them have donated devices from Dr. Kirsch and others of my colleagues. And the other wonderful thing about this device is that the effect is cumulative. The more you use it, the better the result. So over the long term, you see magnificent results without the side effects that you see with prescribed medication.
Now, speaking about medications, we do know that they can be effective. Yes. We know that some people swear by them,
yes,
and some people say they've had problems with them. In my experience, I have not had one client tell me that they experienced negative side effect as a result of using Alpha-Stim.
I have only had 2 people report mild headaches. Some people reported that they got no results whatsoever, but that is by far the exception. I have had literally several hundred, if not more than 1,000 patients benefit from this device over the course of 24 years, and that's really not a bad record.
Colonel, it's been so good to know you, to meet you, to be a colleague of yours, and I'm proud to be associated with you. You've changed the quality of my practice by introducing me to Alpha-Stim. We need to cut it short here, but of course if we had the time, we could present a mountain of evidence proving the effectiveness of Alpha-Stim. Thanks so much.
Thank you very much for this absolutely wonderful opportunity and for spreading the gospel of Alpha-Stim. Greatly appreciate that.
Colonel Platoni, while retired, remains as chief psychologist in the Ohio Military Reserve and maintains a private practice in the Dayton, Ohio area. She also works with police departments in southwestern Ohio, where Alpha-Stim has been adopted and is widely used. You can reach Colonel Platoni at www.drplatoni.com. And if you want to learn more about the Alpha-Stim, go to their website, www.alpha-stim.com, or go to YouTube and type Alpha-Stim in the search bar. Thanks to our viewers for your kind attention. We wish you health and happiness. Goodbye.